Hello everyone, this is Medical Gateway, and in this part we're going to study regarding the allergy and hypersensitivity. Now, what exactly is allergy and hypersensitivity? Allergy is basically an exaggerated response of the immune system to any antigen which is not harmful. Now, our immune system is naturally designed to get activated against any harmful foreign antigen or harmful foreign body. But in the case of allergy or hypersensitivity, the same immune system just gets overactivated or gives a hyper response to any antigen which is basically not harmful. So this includes things like, for instance, food. Food is an external antigen to our body, but in the allergy, the body can give a hypersensitivity response to that. Or pollens, or dust, or mites. These are all normal, non-harmful things, but the body is giving an exaggerated response. This is basically allergy. So in allergy, the most common type is atopic allergies. Now, what is the difference between atopic allergies and non-atopic allergies? Now, atopic allergies are basically the ones which involve things like asthma or like atopic dermatitis, in which the allergens are like dust or pollen or mites, things like that. And atopic allergies have genetic predisposition, whereas non-atopic allergies have no genetic predispositions. And in the atopic allergies, basically IgE antibodies are activated, whereas in non-atopic allergies, the response can be given by IgE and also by cytotoxic T cells. Okay, so let's discuss first atopic allergies, the famous one, which include the asthma, the urticaria, the hay fever, the anaphylaxis. Okay, so what happens in atopic allergies is that whenever there is allergen, now what exactly is allergen? Any antigen which has the ability to cause allergy is known as allergen. Antigen which causes allergy is allergen, or antigen that reacts with immunoglobulin E antibodies are known as allergens. So whenever the body is exposed to allergen, there is production of IgE antibodies, immunoglobulin E antibodies. Okay. Now these IgE antibodies get attached to mast cells and basophils. We have discussed this point when we were discussing mast cells and basophils. So on the exposure to allergen, IgE antibodies are produced and they are attached to mast cells and basophils. Now, on the second exposure to the same allergen, the mast cells and basophils to which the IgE antibodies were attached, those mast cells and basophils are ruptured. So on the second allergen exposure, the mast cells and basophils are ruptured. And when they are ruptured, it results into their degranulation. They will secrete a lot of chemicals like histamine, slow-reacting substances of anaphylaxis, eosinophilic and neutrophilic chemotactic substances, protease, heparin, and platelet activating factor. Now, these are the chemicals which are basically going to cause the allergic reaction or going to cause the inflammation. Okay. So it's the same whole mechanism what we discussed in mast cells and basophils, that allergen is coming, it will result in IgE antibody production, that IgE antibody will be attached to mast cells and basophils, then those mast cells and basophils will be degranulating on the second exposure, releasing histamine, slow reacting substance of anaphylaxis, and many more. So two most important things in it which we are going to discuss in detail are the histamine and slow reacting substance of anaphylaxis, SRA. Okay, now, so what were the examples of atopic allergies? Atopic allergies include the famous asthma, urticaria, hay fever, and anaphylaxis. Okay, now what's happening in urticaria and hay fever and anaphylaxis and asthma? Basically, in asthma, the antigen is present inside the bronchioles. The allergen go and interact with the bronchioles. In anaphylaxis, the allergen or the antigen is in circulation. In urticaria, the antigen is in skin. In hay fever, the antigen is in nose. Okay? Now, the urticaria is related to skin, hay fever is related to nose, and asthma is related to bronchioles, whereas anaphylaxis is related to circulation. Now in urticaria and hay fever, what is going to happen? So whenever the antigen is in skin and antigen is in the nose, histamine is released. We're focusing just on histamine. I have previously said that we will focus on these two substances, these two chemicals, the histamine and slow reacting substance of anaphylaxis. So in skin and nose, the histamine is released, and as you know, that histamine will result into vasodilation and causing increase in permeability of the local blood vessels. So whenever there is antigen in the skin or allergen in the skin, the immune system is going to respond by production of histamine in the skin. That histamine will increase the permeability and will cause the vasodilation in the blood vessels of the skin, which will result into hives and itching and redness of the skin, which is basically urticaria. Same is the case with hay fever. The allergen or the antigen is in nose, and the immune system is going to respond by the production of the histamine. Now this histamine will cause vasodilation of the blood vessels in the nose, local intranasal blood vessel dilation. And whenever the blood vessels in the nasal cavity, in the nasal mucosa, are dilated, it will result into runny nose and sneezing. So this is hay fever. What exactly happens in urticaria? There are hives, there's redness of the skin, there is itching of the skin. Why is this happening? Because histamine is released, which is causing increase in permeability and vasodilation. Why there is runny nose and hay fever? Because the histamine is released, and that is causing vasodilation in the nose. So you just have to focus that where the allergen is located and which chemical is releasing and what that chemical is causing. Histamine is causing vasodilation. Histamine is causing vasodilation. Same histamine when in the circulation. So in the circulation, the anaphylaxis, when the antigen or the allergen is in the circulation, now the histamine will be released in the circulation. Generalized circulation. Systemic circulation. Now this histamine will cause the vasodilation of the systemic blood vessels. And when the vasodilation of the systemic blood vessels happens, it will result into decrease in the blood pressure. So antigen is in the circulation, histamine is released. Histamine will cause the vasodilation of the generalized blood vessels, resulting in fall of blood pressure. And whenever there is decrease in the blood pressure more than a limit, it results into fainting. So in anaphylaxis, the person can faint because of decrease in blood pressure. Now, in anaphylaxis, other than the histamine, slow reacting substance of anaphylaxis, SRA, is also released. And the slow reacting substance of anaphylaxis basically causes bronchoconstriction, the constriction of the bronchioles in the lungs. And when there are constriction of bronchioles in the lungs, the person just cannot breathe. The person will have symptoms like asthma. And same is the case going on in the asthma. When there is antigen is directly into the bronchioles, what is released? Slow reacting substance of anaphylaxis, which is causing bronchoconstriction, resulting into suffocation, the feeling of breathlessness, the feeling that the person cannot breathe. Okay? Which is a very bad feeling. So, slow reacting substance of anaphylaxis basically causes bronchoconstriction in asthma as well as in anaphylaxis. So in anaphylaxis, there are two things which are released: histamine and slow reacting substance of anaphylaxis. In asthma, only slow reacting substance of anaphylaxis is released. That's why in asthma there is bronchoconstriction. And there is no histamine released in asthma. That's why there is no runny nose in the asthma. Okay? Then in urticaria and the hay fever, there is histamine in the skin and the nose, causing hives and runny nose. Okay? So that's why the antihistamine drugs are effective in especially urticaria and hay fever. When you have hay fever, you take antihistamine drugs, which just cures your runny nose. And in hives, if you take antihistamine drugs, it can be treated. Whereas in asthma, if we take antihistamine drugs, there's no significant benefit. Okay? So this is the significance of studying physiology, because this becomes the basis of the pathology and also helps in studying the pharmacology and finally the medicine. Okay, so this is all about the atopic allergies. I have already told you what are the atopic allergies. These are the common allergies which have genetic predisposition. So asthma, urticaria, hay fever, anaphylaxis, there is some genetic disposition to all of them. Okay? And they give response by immunoglobulin E. So, in non-atopic allergies, they don't have a typical genetic predisposition, and they also can act without IgE. They can act by cytotoxic T cells. So let's discuss one of a very important non-atopic allergy, which is delayed reaction allergy. So in the delayed reaction allergy, basically because of poison ivy. Now, poison ivy, as you know, is a plant which when touches the skin can result into increase in the T cells in the skin. Now, on the second exposure with the same poison ivy, those T cells which were produced on the first exposure will just enter into the tissues. And as told previously in the lecture of the types of T lymphocytes, T cells, the T cells also damage the tissue where they are being activated. Okay? So, delayed reaction allergy, which is a type of non-atopic allergy, there is a plant named poison ivy, which when touches the skin, there is increase in T cell production there in the skin. And on the second exposure, these T cells just enter the tissues and they start damaging the tissues. Okay, so this is delayed reaction allergy. Okay, by this we have finished this allergy and hypersensitivity, and we have also ended the chapter related to the immunity. See you in next chapter, which is related to the blood grouping. Okay, see you in next chapter. Bye bye.